The province's police watchdog is continuing its investigation into the death of a 29-year-old woman as questions continue to swirl around how she fell from the balcony of her High Park apartment. Tonight, Toronto police are on the defensive, bringing forward new information about that incident as the family continues to point fingers at officers they believe had a hand in her death.
There were 3 calls from 3 different people, all 911 calls that evening regarding that address. The calls indicated that there was an assault and also indicated that weapons were present.
That new information coming from Toronto Police Chief Mark Saunders 2 days after Regis Korchinski-Paquet fell to her death at her High Park apartment building Wednesday. Thursday afternoon, her mother had told the media she'd called police because her daughter was experiencing a mental health crisis after an epileptic seizure. Regis entered the apartment alone, followed by multiple officers. Her mother and brother told to wait in the hallway.
After approximately 1 to 2 minutes, the mother and the brother heard commotion in the apartment and then heard Regis cry out, "Mom, help, mom, help, mom, help." After that, mother and brother heard silence.
Moments later, the 29-year-old's body was found on the front lawn, having tumbled 24 stories from her balcony. In the hours after the incident, Regis's mother accused police of pushing her daughter to her death, with those allegations circling widely on social media. Today, the police chief asking the public for calm and patience.
I'm asking people to wait. I'm asking people to wait, to get the truth, to not act on misinformation, to not act on lies. You'd be doing a disservice to the family if you are responding on lies and manufacturing things.
The lawyer for the family today responded by offering clarifications on the mother's allegations.
I'm not retracting the statement. I'm clarifying that when the mother made that statement, that was her belief at the time. At this time, the mother understands that she was not witness, and what she wants is answers. So that statement has not been said again. The mother believes that if police had acted differently, that her daughter would still be alive.
The Special Investigations Unit, which has taken over the case, confirmed today 5 witness officers have been identified and 4 of them have been interviewed so far. The police chief would not specify if mental health concerns were relayed to 911 dispatchers, but did say seizures were discussed, adding that a crisis mobile team would not have been dispatched immediately for an assault call because of the threat level to nurses, and that his officers are the best in the country when it comes to de-escalation training.
This is a textbook case as to why I've been advocating for body-worn cameras, and I'm now fast-tracking to the best of my ability to allow that process to speed up so we can have access to body-worn cameras as soon as possible.
Family lawyer says he welcomes that measure, but disputes the idea that police have done well in dealing with mental health cases, pointing to the 2017 coroner's inquest into the police shooting of Andrew Loku, a black man with mental health issues.
With that inquest came 39 recommendations, and the family wants to ensure that those recommendations are implemented. So the question from the family to the public, to all police agencies across Ontario, is have they implemented those procedures? And if they haven't, why not? And when will that be done?
Now, there is a memorial march happening Saturday afternoon from Christie Pitts to Queen's Park. The family today, though, clarifying that they are not the organizers of that event in High Park. Ginella Massa, City News.